Our final presenter before our Q&A panel, I'm shorter than everybody that comes up here except Rebecca, is Mahja Sulemanjee Bortocek. Mahja is the Director of Community Outreach for the Greenhouse Group's premier medical cannabis dispensaries. She actually has a few more titles now, which I'll let her explain herself. She's worked in healthcare for over 15 years in hospitals, rehab centers, and diagnostic centers, and has acquired her master's in public health and business administration. Mahja's passion to help others is noted in her valiant and persistent efforts in community service. She has been awarded and held officer positions as a board member for several senior and healthcare-focused organizations, and is actually on our board for GG Chronic Pain Foundation. Mahja has spent the entire morning conducting the CEU platforms for medical cannabis right next door. Anyone that knows Mahja is drawn to her. Her energy is absolutely magnetic. Please welcome my sweet friend, Mahja. Okay, so right and left, and the monitor's down there. Okay.
Thank you. It has been a wonderful pleasure to be a part of all of this today. It's a humbling experience for me, and I think for many of us who are part of this industry. I want to thank Gracie for putting her amazing effort into all of this event. This is like moving small mountains to make events like this happen, and Gracie has really outdone herself in so many ways. So I'm very, very lucky to call her a friend of mine as well, and I am very, very blessed to be working in this amazing industry. I had never planned this in a million years. I had plans to be a physician. I was going on a completely different path in my life, and then things just brought me here. And so today, I won't spend too much time telling you about myself. I would rather spend my time telling you about this program in Illinois and explain to you a little bit about where we are today, how this has come about, and just give you a general synopsis of medical cannabis and everything that goes along with it. So some of you were in the CME and the CEU portion already on the first presentation. I am going to, if you were in that, this is going to be a little bit of being repeating for you. However, I always come up with new content, so I'll make sure to get some information to you that you may have not heard of already. But more importantly, we're going to talk today about facts. So in this very sticky industry, no pun intended, in this very sticky industry, we actually have to really clarify the facts for people, right? We have to talk about what is cannabis and where does all of that come from. So those are some important things, and I'll discuss those with you. We're going to talk about the science section. I know Dr. Joshi has spent a good chunk of time trying to explain to you some of the clinical trials and different things that are happening. I will give you a good synopsis on science as well in this industry. And then the laws, right? What is happening? Why is this taking place the way that it is in Illinois? Why is it happening the way it is across our country? What is the trend and where are we looking and what is going to continue to happen? So we'll talk a little bit about that. And last but not least, I will take you through a brief application process so that by the end of this presentation, you will not only know what you need to know facts-wise, science-wise, law-wise, but you'll actually be able to go out and help people get certified themselves. You will be able to get certified yourself if you need it or wherever you are. And in fact, in the rooms next door, I believe they are certifying or they're helping with some of the process of consultation if you guys are interested in learning more about that. So, you know, this slide here particularly does my whole presentation for me. And don't strain your eyes, I will read it to you. It's taken right from the Illinois Department of Public Health. It's the same vocabulary that you find in almost every single law that is written about cannabis. So I'll read it to you. It says, modern medical research has confirmed the beneficial uses of cannabis in treating, alleviating the pain, nausea, or other symptoms associated with a variety of debilitating conditions. So when I see a sentence like that, I have to surely read it twice. And what I do is I break it down so that it makes more sense to me. So what this says is modern medical research has confirmed the beneficial uses of cannabis in treating, alleviating the pain, nausea, or other symptoms associated with a variety of debilitating conditions. This is what the Illinois Medical Compassionate Use of Compassionate Use of Medical Cannabis Act is. It says that for a specific subset of people dealing with these conditions, they can activate their right as a medical cannabis patient in Illinois, right? So this says that research is showing these particular people can get benefit. If they live in Illinois, they can activate their right, they can apply for a card, and then they can go ahead and use cannabis as a medication for them. And this is what the law is built on in every state that actually has a program. So why are we talking about medical cannabis? Why do I just not call it what it is? Pot, weed, marijuana, devil's lettuce, right? All of that fun stuff that people call it. It's all almost the same thing, right? It comes from the same type of plants, it has a similar species. But when we talk about medicinal products, it is certainly different, as Dr. Joshi was talking about earlier. And it certainly is. So what I find is trying to explain this to people is a very difficult task. And I'm gonna try to do my very best today to really give you an industry inside on what is really happening with cannabis, right? So as far as cannabis, you have this plant that grows, and this plant gives a flower. But this flower is very different than a rose or a tulip or, a daffodil. It's similar, but it's different. This flower, or this bud, is what we call it. It's very sticky in its nature. It has a lot of aroma attached to it, skunky smell, in fact. If you open it up a little bit and look inside, there's hairs and crystalline all over it. It's a very interesting looking bud that's to the plant. And what we do is we take that bud, we cut it, hang it upside down, and then it becomes a dry herb. And we cure it for about a couple of weeks or whatever it takes. And then once we do that, that dry herb is traditionally what people would put into a pipe or what they'd put into rolling papers, and they would traditionally smoke it, right? Today we know there's a ton of other consumption methods. You don't have to smoke cannabis, but it's still something that traditionally, as far as dispensaries are concerned, still about 50% of our sales, interestingly enough. And there's a reason for that. And I'll talk to you about what that reason is when we talk about consumption a little bit more. So you've got this dry herb, you've got this flower, you cut it, you dried it, it became this dry herb. If you want, you can at that time make it into a food or whatever you want. We'll talk about that later. But I want to try to explain to you the difference of how we can understand this plant, right? So this plant is cannabis, and I could call it any other name, but the reason we call it cannabis is because of the fact that that's the actual terminology. If you look in a botany book, if you look in an encyclopedia, this is the species of the plant, right? Cannabis indica, cannabis sativa, cannabis ruderalis, right? You have all of these different cannabis strains. So for sake of simplicity, I have started to categorize this in a way that makes sense. And I use it as a spectrum analogy. So I look at cannabis sativa on one end of that spectrum. Cannabis sativa is a plant that grows very tall. It has wavy type of leaves that are attached to it. And when you consume this, your effects of cannabis are a little bit more uplifting. They're a little bit more energetic. And they're more really for daytime use for most people. And then on the other end of your spectrum is cannabis indica. And the way I describe that is it's a plant that's really low to the ground. It has really wide leaves to it. And so it tends to have a little bit different effect when you use it. And it helps with people sleeping a little bit more, relaxing, maybe more nighttime use. Think about in the couch kind of a terminology. And then in the middle, you have something called a hybrid, which is half of the qualities of an indica and the other half of the qualities of a sativa. And if you just move a little bit down towards the indica side, you can find a strain that happens to be indica dominant, so mostly relaxing, but it still might have a few types of effects of the sativa because it still might have some of that. So what I'm talking about in this spectrum isn't just a spectrum. This is how genetics works, right? This is my way to simply try to explain to you how genetics works. My task here is almost as hard as trying to explain to you the human race. let's pick monkeys and go through monkeys instead and say, hey, this is the different types of monkeys and we're gonna put them all into order and try to categorize them. This is what I am attempting to very feebly do at this point with cannabis, because it's very difficult to do that. But that's the attempt. So we try to use a spectrum type of approach to it so that people can understand where they might lie in that. So that's just one part of it, and I'll explain what else goes into profiling cannabis a little bit later. But that's something good for you to know. Think about the spectrum. You've got the sativa, you've got the indica, you've got hybrids. So essentially, dispensary staff is left to decide where on the spectrum does this patient sit at what time of the day, right? You definitely don't want to use your sativas at night. You might complain about not being able to sleep, right? So those are the different types of things to be aware of. So why medical cannabis, right? Why not just utilize cannabis? Let's be honest, if we're gonna be honest today, and let's talk about the topic at hand of cannabis. You can go to any high school and probably get this easier than you have a chance of getting your medical cannabis card in Illinois. Illinois is a wonderful state, but Illinois has very strict processes for getting a medical cannabis card. It takes quite some time. So with that being said, it's much easier to go to the street market and to be able to purchase cannabis for people, right? Now the reason we're here is because we want to be able to regulate that. We want to be able to have a better streamline for people so that they know what they get and we can utilize it as a medication, right? So what happens is each and every one of the products, each and every one of the plants, we call it following it to seed to sale process. So this is important for folks to know. If you learn anything, you can go back and talk to some people in the industry and say, I know seed to sale, and it'll make you look like you know a lot. And so the seed to sale process is basically, when this is a baby plant, it gets a little number. And that little number follows it throughout its life cycle, whether it becomes a food, whether it becomes an oil, whether it becomes dry herb and stays that way, whatever it becomes, it keeps that particular number. And when it comes to the dispensary, it keeps that number. And when it goes out to the patients, it keeps that number. The reason this is important to us is we're able to track exactly where this product is going, but more importantly, this is for patients, right? This helps patients to know what is in their product and who's got it. So for example, think about the cars that you've driven in your whole life. We've got a good group of age here, and so you've probably gone through quite a bit of cars in your life. Think back of all the times your car has been recalled. A steering wheel here, a bumper there, or whatever, right? But they don't know which particular car needs to be recalled. They just send the mass letter out and everybody has to figure out which one it is. If you bought it in this year, bring it back and get it fixed out. Not here. We would be able to say, this particular strain went to this particular dispensary, went to this particular patient, and now we know that that is that product, right? And if it had mold in it, or if it had something else in it, we'd be able to count that back. These are agricultural products, guys. Think about the strawberries that you buy. I look underneath, I try to make sure, and then right in the middle is the one with the mold, right? Always. So these are the different types of things to kind of be aware of, because that's how that works, right? It's just the Murphy's Law. And so what happens with these products is we're able to have a little bit more social responsibility there. The other thing that takes place here, this is talking about mold or other types of impurities. When we actually grow our cannabis, we have to send it out to a third-party laboratory test. So it's not affiliated with us or anybody else that we have in our pocket or anything like that, not at all, right? This is a third-party laboratory. They come in, take a random selection of the batch of cannabis, take it to their laboratory, test it, and then let us know what is inside of that. It talks about the cannabinoid levels, how much THC, CBD. We'll talk and I'll explain what those are in a little bit. It also happens to have things like the terpenes and other molecules that might be inside of it. And that gets packaged, labeled, put onto that packet, and comes to the dispensary tamper-proof, so we can't actually get in. So you know exactly what you're getting, right? That way I know if my PTSD patient comes in and wants to purchase a sativa, we can perhaps educate that PTSD patient on why maybe they want to pick a different strain for themselves, right? Because we know what's inside of it. Versus going to the black market or the street market, you're not really able to see what's inside of it, right? It's just a plastic bag. Who knows what's inside of it, what not? So we're constantly testing these products to make sure that no mold gets out, that nothing else is going out to the patients that shouldn't be going out, right? All of these plants, they use natural predators instead of using actually, pesticides, right? So instead of using pesticides, they'll use things like praying mantis or ladybugs. You'll find ladybugs all over because they'll eat the spider mites and the things that we don't want inside of the cannabis. So it keeps the cannabis in unbelievably pure to what it really is supposed to be, right? The pH of the water is exactly where it needs to be. The temperature in the room is where it needs to be. The lighting system, all of these things are really making sure that you get exactly what you are planning to get from it. So those are some important things to kind of recognize. The other thing that we do with this cannabis industry, and while we're growing these products, it's really interesting, is we have, say we wanted to make the dry herb into an oil. We want to make it into a cookie. We want to make it into a whatever. How do we make that, right? We have to do an extraction. We take that dry herb, we use a solvent, usually it's alcohol, butane, carbon, something of that nature, and they'll actually extract that product. So they'll dilute it in that solvent, and then we use a big machine to actually pull out the extraction and to get what we're looking for out of the plant. Once we get the extraction out, then we have to evaporate whatever the solvent we used, right? Whether that be the butane, whether that be the alcohol, whatever it was. The state law in Illinois requires that by law, we have to actually only have less than 10 parts per million of impurities in our cannabis, in our extracts. So that's pretty interesting. It doesn't mean anything to you if I don't put it into context, so let me put it into context. That basically means that if you have, for instance, the air that we breathe in Chicago is known to be 400 to 500 parts per million of impurities. And I said that your cannabis needs to be less than 10. Let me put it into more context for you. I had a really interesting conversation with a pharmacist at Abbott Labs. And we were having this conversation, and they told me, interesting, our genetic medications by law have to have 500 to 400 parts per million of impurities. And I said, really? That's so interesting, because by law, we have to have less than 10 parts per million in our cannabis. So it's just very interesting how this is. And I want to put that into perspective and have you think for a moment, what if all of our food was made this way? What if everything we consumed had these protocols? Can you imagine disease state today, where we'd be, public health ramifications? I mean, just interesting things to think about. So some good stuff to know. The other thing I would mention, as we're going through this, think about the farmers. As much as we're not looked at farmers, so we're not, but we are farmers, right? That's what we do. We're cultivating these plants. We're watched by the agricultural department. This is what we are doing. So imagine these strict ramifications, and what if the strawberry farmers had to follow these strict ramifications, and one of their batches didn't turn out being lab appropriate? They would lose their whole batch. Can you imagine the detrimental effect that would have on that farm? So these are the kind of constraints that the medical cannabis community and the industry and the organizations work with. Because we still can make it happen. So I use the analogy sometimes, let me tie one hand behind my back, blindfold myself, and give myself 1 foot, and if I can still do this, then I can have this industry. And that's exactly what it's happened. And we do, and we practice. And so it's really kind of nice to put things into perspective and really see where we are today with this. So you are getting the purest of the products here in Illinois. Not every state practices this way, be aware of that. Colorado and California have different types of rules, and some rules do apply in other states that are similar to Illinois, but every state makes up their own rules. So something important to know. So let's talk just briefly about some of the benefits of cannabis. So these are some interesting things to talk about, but more so out of just the benefits of cannabis, I want you to understand the constituents inside of this plant. So research shows that there are over 100 constituents inside of the plant, just in cannabinoids. So over 100 cannabinoids inside of the cannabis plant. The most popular one of these is THC. THC, as I like to call it, is the black sheep of the family. This is the one that causes all the trouble, gives you the euphoric feeling, makes you want to go home late at night. Jokes. but really, this is the psychoactive component of cannabis. And this is one of the only psychoactive components of cannabis. The other 99, or whatever they are non-psychoactive in most cases. Some of them slightly psychoactive, but not so much. The next cannabinoid that happens to be in second volume, or is high in volume as THC, is CBD. And CBD is interesting because it acts as an anti-inflammation medication, but it also acts as a neuroprotectant for folks. So what's really interesting about CBD is it can be used for a plethora of different things, and in fact, it happens to have even more therapeutic properties than some of the other cannabinoids that you find in here. The one issue that ends up becoming the thing to talk about is hemp-derived versus cannabis-derived, right? People talk about that quite a bit. And then really to understand a little bit more about how difficult it can be to grow a CBD particular strain, right? So it's not just growing any, you have to try to figure out how do you get these plants in the volume that you want them to be. So sometimes that can take a little bit different work and a different setup to get those plants to be CBD, higher in CBD than THC. So those are some important things. The other things to mention here is, through some research, we've been able to figure out now that CBN is a molecule inside of cannabis that actually helps with inducing sleep. So we know now that this can really do quite a bit for people who are, looking for or who are dealing with insomnia and taking Ambien. CBN, we have capsules. This might be a better alternative for some people to utilize, right? So while we're on that talk, and I might as well just mention it while it's on my mind, but we talk about the fact that, with cannabis and it coming into a traditional market of medicine, there's 4 medications that become actually almost obsolete. And this is probably one reason why we are not, we don't have fans in the pharmaceutical companies. And please let it be known that I believe tradition medication and actually using medication is really important. I wouldn't be able to stand here in front of you today if I am an asthmatic and I, take an inhaler every morning, and if I didn't take that, I couldn't stand here. So I, by all means, do believe in traditional medication. But I want to mention to you that when cannabis is added into the regimen, it can really help reduce some of the other medications that people are on. And this is one reason why we have some battle with some of the pharmaceutical companies. But if you look at sleep aids like Ambien, right? CBN can easily replace what Ambien is doing for people, and they no longer would have to utilize that. If you think about olazoprams or Xanax and things of that nature, right? You can think about the fact that they have CBD, and CBD is an anti-anxiety, right? So again, there you can replace your olazoprams or some of those things, or talk to your physicians, of course, before you do this, but these are some things to know. Along with Norcos, low-dose painkillers like Vicodin, really THC does a great job with that. You can kind of eradicate some of that. And then not to mention mood elevators. Cannabis in every strain, whether it's a sativa or an indica, it happens to elevate mood. So if you look at antidepressant medications, you really can use a better substitute that's naturally and can be, metabolized in your body without really having a big toll on your liver. Those are some important things to kind of recognize. But another one that I really like to talk about sometimes is THCV. THCV is an important, it's a slightly psychoactive component of cannabis. It's important to talk about because it does something really interesting. It actually reduces your appetite. So most of us here think that, you use cannabis, you're gonna get the munchies and you're gonna eat. And in fact, a lot of cancer patients come to us for that particular reason, right? Nothing tastes good anymore. I haven't been able to enjoy a meal in a long time. What am I gonna do? And so this gives them the opportunity to come in and to be able to utilize something. Now, if I gave them something with THCV, that cancer patient would go home and not feel hungry. So I have to know that THCV can cause them to perhaps have a suppressant of their appetite, right? They need something else. They need something that's gonna cause them to be more of an appetite. So those are some important things to kind of recognize and why it is so important that we know what's inside of our products and we understand the constituents of these cannabinoids and what their effects are. So what are these methods of consumption, right? So you can choose a ton of different ways to utilize cannabis today. Smoking and vaping are still amongst some of the more popular versions of utilizing cannabis. And the reason that is simple. It's because it goes into the bloodstream almost instantaneously. Because it causes the effects of cannabis to happen almost instantaneously. And if the person is feeling pain, they will feel relief almost instantaneously, right? So when you smoke something, it goes into the lungs, the capillaries get it, and they send it right into the bloodstream. So that gets into your bloodstream very quickly. It's almost as fast as intravenous, and so it really does cause that effect to happen quite often, or quite quickly. It lasts for about 2 to 4 hours, depending on the person and depending on their consumption history. And it takes about a couple minutes for them to kick in. So this is not, of course, a therapeutic way for somebody with lung disease or for anybody who has issues with their lungs, right? right? The epithelial tissue does not like smoke. I don't care where you are or what you do, it doesn't like it, so it's something to take precaution about. But yet, this is the fastest and most quickest onset. Now, the difference between smoking and vaping is that if you smoke something, you take the material and you use fire and you light it on fire, and it causes a combustion to happen, and you get smoke and soot. And that has the carcinogens and all of this other stuff that's in the cannabis, or not just in the cannabis, but in the materials and all of that. And so you have that. If you vape something, there is a battery. And there is oil, and that battery slowly heats up to the temperature that it needs, and it stops between the phase of actual combustion, right? So you just have the vapor coming out of it. So those are the differences. It's much lower temperature at that with vaping. The consensus is still out on what's safer than the other, but that's something for you guys to know is a method that's available. Tinctures and sublinguals are a phenomenal way to medicate, in my opinion, are underutilized, but they are phenomenal. This is what was found back in the 1900s. This is what you can go into a pharmacy and purchase back then. This is what was in the pharmacopoeia back then. This is a great way to utilize. They sold in a baby Motrin bottle. It's a dropper full, drop it underneath the tongue, swish it around in your mouth if you have the ability to be able to do so, and it can go in then sublingually. It takes about 10 to 20 minutes usually, and the lasting effects can be anywhere from 4 to 6 hours. This is a great method for a caregiver giving to a small child or an elderly Alzheimer's patient or something like that, right? So this would be, I talked about the dropper full maybe being about 5 milligrams or so of cannabis, 2.5 to 5. Those are called micro dosage. In a lot of the research that I've done, cannabis is very biphasic. So at the right dosages, it can be incredibly fruitful and very helpful. At the wrong dosages, it could do not that what you're looking to do medically for it. But so that's kind of where you have to find. And micro dosing is a great way to go. You start with a little, you can always add more. It's like cooking with salt, I say cannabis is. You can't pull it out once you've had it. Let's talk about oils and waxes. So I want to talk about these because the concentrate form is called wax concentrate. What we do is we take these extractions and then we get a very thick type of a solvent or a wax or a shatter or something like that. And this is what you might be hearing nowadays called dabbing. Dabbing can look scary. Dabbing is a torch that's very high temperature and lighting a material or a piece of quartz usually at a very high temperature and heating it up till it's glowing red, and then taking that glowing red part and touching it typically on the concentrate and then inhaling that. Now, people gravitate to that who have been using cannabis for a long time because it's a smaller dose that they need to feel the effects much longer. So that's an option that's available out there as well. Now, as far as oils are concerned, oils are taken sublingually or they are taken through the digestive system. So it depends on how you consume it. These oils are sold in a syringe, but they don't have a needle. They just have like the syringe part of it, and you can dose yourself out how much you want. Typically, the rule of thumb, or the rule of nail, as I call it, is a half of the tip of my nail. If I take a little glob of it, it's usually 25 to 35 milligrams. I talked about that dropper full being 2.5 or 5 milligrams versus now this little part of my nail being 25 to 35 milligrams. Big difference there. Very potent form of cannabis, RSO, we call them RSO oils or CO2 oils. These are the most potent form of cannabis. These are very sedative in their nature. These are great for patients who have been experiencing high level of pain, been utilizing cannabis for a long time, can't find some relief, they would be able to gravitate to this. This is also where cancer patients kind of go towards because of some of their own self-research that they've done with some of the oils and whatnot. Edibles. Edibles are an interesting way to use cannabis. They're a phenomenal way if you know how to utilize them right. They are sometimes not as easy to dose for new patients. So when I get grandma coming into me and saying, I don't want to smoke anything, I just want to eat some cannabis, and I think that's the best method for me, we can talk to them about how to dose with this. But it becomes challenging because of the fact that they happen to have, once you take it out, once you take it, you can't really pull it back out. So I'll explain. What happens when you eat something is it goes through this long route to get to your gut. And when your gut gets it, it sends it over to the liver. And when your liver gets it, it changes the THC component just slightly from a delta 9 to a delta 11. And basically all that means is it goes through the blood-brain barrier a little bit quicker, and it causes almost 4 times more of the intoxication feeling, so it's a little bit stronger. Not as strong as maybe the RSO, but if you decided to eat it, it would be very strong. So this is a stronger effect. This is why people can say to you that I've used cannabis for a long time, my whole life, and I can utilize it as smoke fashion, but when I eat it, I just go through the roof. It feels so strong for me. And this is particularly why your body metabolizes it differently. So it's something important for folks to know about edibles. They're an option out there. If you utilize it, it takes 1 to 2 hours to kick into your body. It will last for about 8 hours. So it's something to be aware of, 6 to 8 hours, depending on where you're at with things. And all of this is dependent on your level of expertise, on your experience with cannabis, right? Could change from time to time on how much you use. We also have topicals that are available. Topicals are a great thing for analgesic pain, right? Like, I know it's my elbow that hurts, I will put it on my elbow. I know it's my knee, I can put it on my knee. Now, this doesn't get to the root form of treatment, right? This only helps people with from an outside perspective. When you actually look into getting to the root cause of pain, you need to put something systemically into your body. So you need to address the inflammation and you need to address the neurological system, right, to help with some of that pain. But this is a good option that's available. Transdermal patches are also available. Transdermal patches are quite amazing in what they do. They are you clean off the area of the body that you intend to put it on with a alcohol swab, and then you let that dry and you put it on a venous area of your body, either your wrist, your neck, or your foot or something. And what'll happen is it lasts for about 12 hours, and this will kind of time release the medication into folks' body. And they come in, THC, CBD, CBN. This is a good form of medication for somebody who's looking for long-term relief and wants to utilize a patch. Believe it or not, we also have suppositories. These are a good way to medicate for folks who have been using cannabinoids for all sorts of whatever treatment and whatever process they're looking to accomplish. And what ends up happening is if they feel too much of the head high feeling and they don't want to have that, this is a good way to add more cannabinoids into their bloodstream without actually having to use more of the side effect of cannabis, which is that head high feeling of it. Some of the more recent research that I've done is the absorption is great for, to take from suppositories, but the effects aren't quite as much as what people are looking for. But they're available out there too, so we usually suggest to patients if they want to utilize that, that's something that they can. So we'll talk quickly about dosage and safety. And, this is kind of a silly little slide, but I really like it, and it does make sense. And, when we talk about cannabis, we talk about so many things, from the science portion of things. We talk about, the medicinal side of cannabis. We talk about so many things, but we also sometimes forget to talk about the civil rights movement with cannabis, right, and all of that. And we know today that poor diet and exercise has a tremendous effect on our lives. We know that alcohol consumption causes, detrimental effects to society. We know that tobacco use alone is killing tons of people, and is, the carcinogens are in there. But yeah, you can go to any grocery store and purchase it. You can go to any store and be able to buy this at any gas station or whatnot. So this has become one of those situations to talk about where civil rights comes into play. But I wanted to just kind of make a mention of that. But you can see cannabis traditionally just solely on cannabis, not with it being stripped with fentanyl or all these other things and the other portions of things, but really purely just cannabis, utilizing that consumption period is not going to cause you to lethally overdose. You can overdose. You're not going to feel well. You might feel very sleepy. You might feel nausea. You might feel a lot of different feelings. But you're going to wake up the next morning. I joke around and I say one of the reasons that me and my staff sleep so well at night, it's not because we use cannabis, but it's because of the fact that we actually, we know our patients are going to wake up the next morning. We can tell them to go home and take, 15 milligrams of cannabis, and if it was too much, they're still going to wake up the next morning. So hopefully they didn't mix it with a ton of other stuff, but if it's just purely cannabis that we're looking at. So we talk to patients about going slow and starting low. Right? Go low, start slow, like this is just the way it is. You can always add more. Like I said, cooking with salt, it's important. Be patient with your dosages. Very important for you to think about how you're taking this, especially with edibles. Space them out. You can't imagine, I can imagine every dispensary person in here has probably dealt with this so many times. They get that phone call. I took the 10 milligrams, it didn't work as well, so I took another one an hour later, and now I'm on 20 milligrams for 8 hours. And that can be a lot for patients to deal with. So those are some things we tell them, to kind of space out your dosages. like any other medication that people are using, any other medication. It's the same process, guys. It's gonna take about 2 weeks for you to learn how cannabis affects you. It is gonna take a little bit of time to understand this, so give yourself a 2-week window. Work with your dispensary staff and your physician to be able to figure out the best realm of expertise here and where you need to be with it, right? So those are important things to talk about. I mentioned, not to mix it with alcohol. It's only because of the fact if you're having 1 beer and, it's fine, it's not a big deal. But if you have 5 beers, it's going to make you feel like you have 10 beers, right? If you have 100 milligrams of, I don't even know how Norco really works, but if you have, a high dosage of Norco or Vicodin or something like that, and you add cannabis into it, it's going to make that Norco or Vicodin that much stronger. So I insist to folks that you need to talk to your physicians. I call it coming out of the closet with your doctor. And it's important because you need to address these things with your doctors. Your dispensary staff is not physicians. We will never answer physician-related questions. We will always direct you back to your physician. So it is good to talk to them and say, Doc, I've been using cannabis for 3 months now. I sleep really well at night. One of the reasons I was taking it is to help me sleep. Can we stop taking my Ambien now, or can you start weaning me down? These are the kinds of conversations we should be having with our physicians, right? I was taking Norco all the time. Now I have pain relief from cannabis. Can we start to take myself down off of these things? Those are difficult conversations, but they need to start coming out. It does a couple things. It helps you get the right regimen that you need, and it helps other people understand cannabis better, especially physicians, because they need a lot of that help with it, right? So talk with your docs. We talk to people about keeping a log. This is just a generic type of a log, but I really do like it. This helps us at the dispensary level understand where we are with folks, where you can share it with your physicians, whatnot. Talks about the date and time that you use your cannabis. So this date and time that you use your cannabis is important to me because if you're complaining to me about not sleeping at night, and I look at this form and you took a sativa at 9 o'clock at night, probably makes sense. And I'd be able to tell you that by looking at that sheet, right? We talk about how did you use it? What method of preparation did you use? Did you eat it? Did you smoke it? Did you use an oil, a patch? What was it? So we better understand that. What strain was it? What smell or taste? Just like any other profession, people will say, I left the bottle at home, I don't know. Oh, I don't remember what it said on the bottom. That's okay, tell us what it smelled like to you. Tell us what it tasted like to you. If they tell me it smelled like lemons or it tasted a little bit lemony, perfect. I at least have some start to know that, hey, they're probably working in the limonene family of terpenes. Let's start there and figure out where we can go from there, right? So it gives us some clue. Also talking about symptoms on a scale from 1 to 10, how effective is this for you? If you're using it for seizures, did it help? If you're looking to take it for pain, did it help? If you're looking for nausea and we're at a 4, we know we have some work to do. We have to find out where in the cannabinoid family you belong to, what terpenes are working against you or with you, and figuring that piece of it out. Notes for yourself, notes for your doctor, notes for your dispensary staff, and then length of effect. If you utilize this, and I said to you an edible should last about 8 hours, and you came back and said, well, I only felt it for about an hour or 2, that's something we should know, right? That's something we need to readdress. I mentioned this earlier today, but I had an experience with a woman who had gastric bypass surgery, and she didn't want to smoke it. She wanted to eat cannabis, and she said, well, I'm willing to try it. She came in, have no experience with cannabis. I'm going to start at 5 milligrams dosage on cannabis, like normal. We started her there, and she said, it didn't really work. So we bumped her up to 10. Didn't really work again. A week later, we said, okay, try 15. Still not really feeling the effects. A couple weeks later, she's at 35 milligrams of cannabis, and I'm calling the lady's bluff, thinking she's not telling me the truth because there's no way this is not affecting her if she's new to cannabis. So we went through this form, we did this research together, and we came to find out that she had gastric bypass surgery. This wasn't going to affect her the same way, right? She was basically flushing a lot of that out of her system before it could even get to where it needs to get. So these are the important types of things in the conversations that have to happen at a dispensary level, that have to happen with physicians and things like that too. And then an overall score from 1 to 10 on how exactly does cannabis, this particular product affect you. So I'll get you guys through the science section as quick as I can. This is some of my favorite stuff, but I know that's not the case for everybody. This is something that I urge you to research in my educational excuse me, endeavors. I have really, taken one thing with me, and that is to research, and to not believe what people tell you, and to take your own opinion and make your own opinion. So that's important here. I would urge you guys to go to things like medscape.com to go look in other types of research articles and to look up the endocannabinoid system. You will be floored by how much research there is, and you will be surprised to know this is one of the first times you're hearing about this. So basically what this is it's a bundle of nerves in your nervous system or in your brain and throughout your body that cause these different reactions like homeostasis to happen. I'm sure Dr. Joshi mentioned quite a bit of that to you. But what's happening here is that, homeostasis is your body's ability to regulate itself, whether that's with eating, that's with sleeping, that's with, stress level, whatever it may be. That's your body bringing itself back to where it needs to be. So a good example of homeostasis is if I step on a rusty nail, my foot will pull away from that rusty nail, and my brain will send messages, chemical messages, down to my foot to say, constrict those blood vessels. We don't want her to bleed out. Constrict, let's send some white blood cells down there in case she gets an infection, right? All those things. So what's happening here is my body's endocannabinoid system is trying to put things back into homeostasis. So basically what happens is that you have these CB1 receptors and these CB2 receptors throughout your body. We call them the endocannabinoid system because your body creates a molecule called anandamide and 2-AG. Anandamide specifically is similar in its effect and attaches onto receptors that same as THC attaches onto. And that's why THC got linked up with this endocannabinoid system just through some freak of nature and really just, what it is with this. So this is kind of a good way for you to look at where the different centers of cannabinoids tend to be. You can see the high concentration in the brain. You can see in the fat cells, in the adipose tissue there, in the liver, in the gut, hence Crohn's disease and a lot of other conditions, hepatitis, things of that nature. And this is all happening at a synaptic cleft. Like THC is very important here. THC comes in and opens these channels to happen. There's a huge mechanism, and we do a presentation for credits for CUs, for physicians, and whatnot on just the endocannabinoid system. So it's important for you guys to learn more about that. So just to kind of keep up with time, I know we're getting short on it. I want you to know that endocannabinoids are derived from the brain. These are like fatty, these are like food sources like omega-3s and omega-6s. They're fatty acids. Also, our body creates this. It's called anandamide when we create it. Phytocannabinoids come from the plant. They're THC, CBD, CBN, all of these. Those are phytocannabinoids. They are also found in turmeric. They're also found in black pepper. They're found in a lot of different plants. And then we have synthetic cannabinoids, which are made in a laboratory, and right now it's just THC only. So just briefly, we want to talk about the scale has shifted, right? This whole thing started in 1996. This started with Proposition 401. I don't know why they didn't call it 420, because it's always hard to remember, but it's true. But Proposition 401 is where it started. So now we're 20-some years into this program. It's shifted now all across the country. This is what the country currently looks like. We refer to it as the green rush. And it's exactly what it is. Organizations like ours, when we find out other states are getting licenses, we're like, ooh, we know how to do this. Let us do it over there. So it's kind of fun and interesting what we have. This leads us to the medical cannabis pilot program in Illinois. Now, Illinois, does a lot of things, right or wrong, as you may see it, but this program has been pretty well done. We, through all of the other states that offer it, really, Illinois has some really prestige processes for getting great products, but a little bit more difficult to get a card in some cases for patients, but there is a process for it. So this was all signed into act by Governor Pat Quinn back in 2013. The first dispensary opened its doors in 2015. So I want you to understand this industry a little bit more in this aspect. Imagine a new business in its first 2 years. All of the paperwork, and not just paperwork, but all of this, really the standards that need to be created. So this is not only a new business, this is a new industry. Standards are not there. We are creating everything as we go, processes, procedures, all of that. So important to kind of know. So folks who are eligible you have to be a patient in Illinois, you have to be a resident, you have to have a debilitating condition, you have to have a physician sign your certification for you. If you're a veteran that gets care from the VA, that is the only way. You don't have to have a physician sign your form. Otherwise, a physician will certify you have a bona fide relationship with them, they've done a medical examination within the last 90 days of you, and that they've reviewed your medical chart for the last year. So that's required. You do also have to go through a background check. They're looking here for violent crimes or substance abuse felonies. If you happen to have a misdemeanor, it's not a problem. It's just those particular types of issues that they're looking to kind of keep clear from the program. If you're a minor, you need 2 doctors to help you certify, one that reviews the physician who certified you. And then if you happen to be a law enforcement officer, a CDL, or a bus driver, you're excluded from this program. You would have to relinquish your occupation to be able to actually join the program. So let's talk about these quickly, approved conditions, right? So you can see this is a huge range from cancer to PTSD to MS. I mean, they're just all over the board, right? And a lot of folks ask me, well, how is it that then one product works so well for all these conditions? And then I have to take them back a few slides and say, remember, my cancer patients don't use the same thing that my Parkinson's patients use. My Parkinson's patients don't use the same stuff that my PTSD, or perhaps they do, or my PTSD patients use. So everyone's utilizing something different. And the cannabinoids and the volumes inside of all these are different, right? So depending on what they're looking for in their plant and the diversity of this. So just briefly, terminal illness is a separate application process that you should know about. It qualifies a person who has been given less than 6 months to live to be able to get their card within 14 days. Their card only lasts for 6 months, so it's something to be aware of, but this is a nice expedited program for folks who really need that additional help. The program now is going on until 2020. This is really decriminalized cannabis. The only issue is that we remain a cash-only business. So through all the regulations we talked about, all the difficult processes that we have to do, and the way that we upstand and uphold our end of the bargain in this area is really well done from a dispensary and cultivation standpoint, but we do not have the aid that we need specifically to be able to make it not cash, right? So insurance companies don't cover this. It would be a claim that would be denied. Credit card companies would deny the claim too. They wouldn't make payment. So there's some things to work on still. So a 1-year card is $100, a 2-year card is $200, a 3-year card is $250. If you're a veteran or if you have SSI or SSDI, you would get 50% off. I tell people that if you don't know what SSI is or SSDI, then you don't qualify because you would know if you had it. So just some more veterans information there. And obviously, I'll just leave you guys with we're almost done here wrapping up, but I'll just leave you with this. Obviously, picking the right dispensary becomes incredibly important, right? You have to have some informed staff. Physicians don't know this information. You are getting this from your dispensaries. So it's important that you pick a good one and that you make a friend with somebody at a good one so that you can kind of understand and talk people through this. I know there's a lot of wonderful dispensary folks here today learning and taking the steps to get educated on this. So I commend you for doing that, and for the physicians and everybody else in the room who really wants to learn. But imagine the stress of the patients that come to us. Nobody comes to a dispensary to purchase cannabis before they tried 5 rounds of chemotherapy or radiation, right? That's just not it. They come to us as a last resort. They're very broken, they're very desperate, they're looking for help. So we have to have compassion. We have to have knowledge and understanding of how to deal with those people. And so that's a big part of what we're doing. So obviously inviting them in and making them feel comfortable, educating them, giving them the variety of products that they might need, and then to be able to really give them some of the holistic portion of things is important, along with really having community programming and development, right? This is a whole sum of things that we're looking at. So this is what a card looks like. You can pick a 1-year, 2-year, or a 3-year card. And as far as a patient or a caregiver are the only 2 people that can have a card. As a patient, you can pick anybody to be your caregiver. I would suggest it's somebody you trust by all means, because they will have access to your allotment. You get 2.5 ounces every 14 days, so that's something to keep in mind. And if you have any changes, or if you know anything that changes with your name, you get married, or you don't happen to have the disease, or your card was lost or stolen, let the state know. They do want to know these things. They are pretty good at keeping track of that. and then renewing your card. As of right now, you'll get a piece of mail 90 days before your card expires, and that will let you know that you need to go ahead and reapply for your card. And usually it's a signature and sending a cash or a check over to the state, and they can help you with that. And I'll leave you with this. This is one of my favorite slides of the evening, and it's just funny, it's cute, but it's really, it speaks volumes to me, and it says, "Speak up, little buddy. Education, not eradication, is the key." I think from everything you've learned here today, I think that's the biggest takeaway, right? This is something that has over 100 constituents that can help somebody therapeutically. It is an outrage to not research it, right? So there's where we are today with cannabis, and that's all I've got for you. Yeah.